and jail project manager, and Ken Fritz, the Winona County Administrator, who will be available for questions. Our forum ends at 8:30 p.m. We have reserved 20 minutes at the end of the panel presentations for questions and answers. If you have a question for a panelist, please use the chat function on your Zoom portal to list your question, and please identify which panelists you are asking the question to. We will try to get to as many of your questions as possible, and we may combine some of them that are similar. To provide you with additional information in advance of the forum, we prepared a talking points document, which you can find on the county's website. It's in the link below the notice about this forum where it says click here. And just an advance warning, if I have technical problems, which I have been experiencing with my computer lately, I may disappear for a moment during the forum until I can get back. Well, let's begin. First, it's important to have some historical context. By way of background, before I became county attorney in 2011, I was a public defender for 20 years in Winona County and our surrounding counties. I represented literally thousands of clients and spent countless hours meeting clients who were held in the Winona County Jail, as well as in Houston, Wabasha, Fillmore, and Olmsted County jails. So I come to this forum and my work as county attorney with some real experience perspectives on the futility of simply housing people in jail. As a public defender, I was also a member of the 2006 Winona County Committee to examine the need for a new jail back then. Consultants from the National Institutes of Corrections, who were assisting the committee, recommended that if the county didn't build a jail at that time, then they should start a Criminal Justice Coordinating Council to examine ways to reduce the pressure on the jail population by means of introducing criminal justice reform programs. The county board chose that alternative and in 2007 established the CJCC. I served on the CJCC from its beginning, first as a public defender and now as county attorney and chair. I actually ran for county attorney based on my experience as a public defender and serving on the CJCC because I realized that I could do more as county attorney to bring reform to the criminal justice system in Winona County with smart on crime programs through prevention, early intervention, diversion, and reentry services, and community support services to keep people from reoffending and to help them maintain stable housing, jobs, education, and family lives. The CJCC has been a strong and active advocate for criminal justice reform measures since its beginning. As was intended by the National Institutes of Corrections recommendation, the CJCC was designed and is operated to include all stakeholders in the Winona County justice system, including policymaking representatives from state, county, city, private entities, public defense, and the community, the public. The CJCC has employed a collaborative, multidisciplinary, system-wide focused strategic approach in identifying and addressing justice-related issues. The criminal justice reform programs that the CJCC and other justice partners established were designed to work to divert people out of the criminal justice system at various points along the traditional justice system path, called the System Intercept Map. I'm going to show you, if I can get my screen up here, that System Intercept Map. There we go. And I'll ask Ken there or Ron, can you see that on the screen? No?
Not yet, no.
Not yet, okay. Let's see, oh, gotta hit the share button, there we go. How's that? Can you see that now? Okay, thank you. So this is just a very basic schematic of our criminal justice system, the points of diversion in that system where people who are in jail or in the system can be diverted out of the system. And it's a way for me to talk about just briefly the programs and processes that we have employed to reduce reliance on the jail. And these programs are all along the way of this system. starting with 911 call, arrest and initial detention, and prosecution decisions. Also, at the first appearance in a criminal case, there are decisions which can affect the jail population. And then further decisions during continued incarceration and all through the process of a criminal case, including the adjudication. And finally, at sentencing and sentencing modification. The criminal justice reform programs in Winona County have been developed since 2009, starting with our care or community assessment and reintegration reentry program, which was an early intervention, prevention, diversion, and community reentry program, and stabilization program to provide support for people coming out of jail. We also have our Winona County Substance Abuse Drug Treatment Program, which started in 2012, and the third Judicial District-wide Veterans Court started last year. We also have within my office and in partnership with the Department of Corrections, our Adult Misdemeanor Diversion Program, which started in 2011, and an enhanced juvenile diversion and restorative justice program also with the Department of Corrections through my office in 2011. And again, these are just some examples, some of the more prominent examples. Then back in 2016, the CJCC obtained a Justice Mental Health Collaboration Program grant, which provided crisis intervention training for law enforcement and other professionals in the criminal justice system. It also established a very important position of jail intake worker to provide bail evaluations, timely bail evaluations, and perform initial mental health and community screening. And toward the end of that grant program, we also then developed the Winona County Reentry Assistance Program, or WRAP for short, which took the place of the CARE program, which had ended because of the state funding ending. Then just recently in October of 2020, the CJCC received a second Justice Mental Health Collaboration Program grant, which funds our WRAP, what we call WRAP Plus program, which we are working with our partners to develop. And that includes, again, the previous WRAP services, but adds a jail social worker position, a community connector position, and coordinates services through a local mental health provider, and provides additional training for law enforcement in mental health response situations. For more information about CJCC and the work that CJCC does, please refer to the county website, and there you can find the Winona County CJCC.org. Now, these and other programs helped to reduce the pressures on the jail population by incarcerating only those inmates whose life history and current status indicate that they would be a threat to the community if not confined to the jail. However, the county reached the point where the criminal justice reform programs were insufficient to prevent a jail shutdown due to the facility itself not meeting current Department of Corrections environmental and structural standards. Our panelists from the Sheriff's Office will present more information about the jail project, but before we get to them, it's important to also then provide to you information about other programs the county provides for all county residents, including those in the criminal justice system. And for that, I'm going to turn over the podium, virtual podium, to Karen Sanis.
Good evening, everyone. I'm Karen Sanis. I'm the Health and Human Services Director for Winona County Health and Human Services. I was very thrilled to learn tonight that I would be a panelist on this presentation. I always like to showcase our work that we do in our communities. Our work typically in our communities goes unseen until there's been a major event or anything. So I just was really happy to be able to provide this overview of our services. So I am going to pull up my presentation and share my, let me see. I will start sharing my screen. And so as I said, I'm Karen Sanders, the Health and Human Services Director, presenting on the Winona County Health and Human Services in the proposed jail project. The purpose for my presentation tonight is to respond to Winona County's community call for action for community-based services for our adult jail populations and our juvenile justice populations. We heard clear that there's a lot of concerns within the community about housing inmates in the jail and that inmates should not, or individuals in the community should not have to go to jail in order to be able to receive the services they need. So I wanted to provide an overview for you of the services that we have available within the communities. But before I do that, I wanted to provide you kind of with the kind of three buckets that we kind of put our services into. Our initial one is the primary prevention services. That's a universal intervention strategies and prevention problem behavior of all individuals living in a home or living in the community. Our secondary prevention is early identification and intervention of minor problems and challenges that occur in a home, school, work, or community. And then our tertiary prevention is our intensive and individualized plans that address a unique biological, physiological, or social needs of an individual to ensure success in the home and community. So as it presents to our current problem that is population. So our primary prevention is education in the community for everyone. Education for the community about mental health and substance use as a high-risk indicators for violence and or other criminal behavior that could lead to incarceration due to being a risk to public safety. Our secondary prevention within the county is our target population. These offer early identification and assessment and community-based services for individuals having early symptoms or minor problems due to the mental health and or substance use disorder that are living in our communities. Our tertiary prevention are our reactionary response of services due to an action or an episode by an individual. Services available to an individual with a mental health and or substance use disorder who becomes incarcerated due to violence and or criminal behavior who has become a risk to public safety. So our initial community's call to action is citizens of Winona County should not have to be incarcerated to receive the services they need. With that is our adult jail population. And Winona County Health and Human Services realizes that the need for services for our adult jail population is vast and broad, but for the purposes of this presentation, we'll primarily be focusing on mental health and substance use disorders, as these disorders are more likely to cause individuals to become a risk to public safety. Winona Health and Human Services is the designated local mental health authority for Winona County. This designation requires Winona County to assure that there is a broad spectrum of services for its citizens that have any type of mental health diagnosis. So our secondary prevention, remember this is our population. Community-based services available in Winona County for individuals with mental health and substance use disorder. This is not an all-inclusive list. This does not include services from other counties or state, and this does not include telemedicine services. So service providers within Winona County, these are Hiawatha Valley Mental Health Services, Winona Health, Winona Counseling, Counseling Associates, Counseling Resource Center, Acumen County Counseling Services, Family and Children's Center, Wendon Recovery Services, Common Ground, Winona County Health and Human Services, Wood Psychological Services, Catholic Charities, and several other independent providers. The services provided in Winona County by these providers are numerous. And so we have, I'm not going to go through each and every one, otherwise we're going to be here all night. But we want you to know that these are all available to individuals within the community on a voluntary basis. So psychiatry, we have outpatient substance use disorder, we have cognitive behavioral therapy, we have medication management services, we have treatment court, we have sober housing, we have Hiawatha Bluff supported living. We have community alternatives for disabled individuals. We have personal care assistance. We have substance use disorder individual and group sessions, just to name a few. But we do believe that we have a very, very good, solid foundation of services available within, on a voluntary basis for anyone that is wanting to access them voluntarily. Other community-based services that we have, and again, this is not an all-inclusive list, are healthcare, income-based health insurance, food supports, housing support, educational supports, employment and training, disability services, independent living, in-home nursing supports, family home visiting, parent support outreach programs, WIC or food shelf, rental assistance, emergency assistance, MFIP, SNAP, just a few. Like I said, a very, very vast and broad service array for anybody on a voluntary basis that is seeking help with any issues that they may be having. So our tertiary service for our adult child population. Remember, this is our reactionary service. This is when there's been an episode or something that has happened in an individual's life. So unfortunately, there are times when an individual with a mental health or substance use disorder becomes a risk to public safety and needs to be incarcerated. This is the reason it is imperative to have services readily available within the jail facility. The trans-theoretical model is an evidence-based model, and I'm going to go ahead here in a second and show you what that is, that depicts the stages of change. In people with mental health and substance or substance use disorders, they can vacillate between the pre-contemplative stage, contemplation stage, and the preparation stage, sometimes for years. Here's that model. Pre-contemplation model is there's no intention of changing their behavior. Contemplation, they're aware of the problem exists, but with no commitment to action. Preparation, intention on taking action to address the problem. And so this is where sometimes individuals can vacillate in between these three steps, sometimes for years before they will take the action to get the help they need. Sometimes for individuals to take action or seek help that they need, it takes a major life event. These events can include significant health event, threats of loss of a significant other, or incarceration. In general terms, this is the individual's rock bottom, and they are motivated to change. This is why we need to have quick and easy access to these services. And again, that's that trans-theoretical model. Where when action is taken, there's active modification for behavior, and then we go into maintenance. Sometimes we go into relapse, and then the cycle can start all over. Our second community's call to action. We should not be locking children up, and instead we should be providing them with services. Our juvenile justice population. The citizens of Winona County have stated that they don't want the children of Winona County in a locked facility and have expressed concerns over the proposed locked juvenile beds in the new proposed jail. They have stated that we should not just be locking children in a jail cell, and that should remain in their communities with services. Winona County realizes the need for services for our juvenile justice population that is vast and broad, but for purposes of this presentation, again, we'll be primarily focusing on mental health and substance use of this target population, as these disorders are more likely to cause individuals to become a risk to public safety. Winona County Health and Human Services is the designated local mental health authority, again, for Winona County. This designation, requires Winona County to assure that there's a broad spectrum of services for its citizens that have any type of mental health diagnosis. Secondary prevention, remember that is for our target population. The secondary prevention and community-based services available in Winona County for children with mental health and substance use disorders. The service providers in Winona County for this target population, again, Winona Health, or Hiawatha Valley Mental Health Services, Winona Counseling Associates, and again, the list goes on and on. Legacies, Home and Community Option, and several unique school programs. Services provided in Winona County. Again, I'm not going to be going through this, but I am going to highlight a few that assure that our children can remain in their homes. Some are electric home monitoring. Um, we have an intensive tracking system that will provide supervision to children while they're in the community, so they can remain at their home, but just with some check-ins through an intensive tracker. This tracker can also provide UAs to assure that the individual is not or is drug-free. But again, there's vast services available within the community on a voluntary basis for any child that has a mental health or substance use disorder diagnosis. Again, we have children's mental health case management services. And remember that all of these services are either provided directly by the county or through a contract with Winona County between a private nonprofit agency or just an independent service agency. Placing youth in a juvenile detention facility. Winona County Health and Human Services and the Department of Corrections always has to choose the least restrictive placement for children. This requirement is outlined in statute, and there are several very strict guidelines for when a child can build a locked facility or a detention facility. To assure transparency and compliance with this requirement, Winona County Health and Human Services has what is called a family preservation team and a juvenile screening team. These teams are multidisciplinary teams, which are comprised of members of community agencies, county social workers from all disciplines, school members, and the Department of Corrections. And let's not forget our county attorney's office. Our family preservation team, they meet when a child is at risk of out-of-home placement for mental health and or substance use disorder treatment. In order for a child to be placed into an out-of-home placement in a treatment facility, a clinical assessment needs to be completed, which indicates the need for placement and an exhaustion of community-based services. The family preservation team has the child, the parents, and any other person the child and family indicates are relevant in the child's life also attend the meeting. Our juvenile screening team meets bi-monthly to discuss children that are receiving community-based services. The team discusses children that are engaging at-risk behaviors in different environments, issues with compliance with the child with community-based services. They review barriers to access to services and assuring communication between multiple providers. The team provides planning for community-based services for children transitioning back to the community from a treatment facility. Local option for juvenile detention. Unfortunately, there are times when a child poses a risk to public safety and a child needs to be held in a detention facility. The facility that held most of our juveniles was the Olmsted County Juvenile Detention Center, which allowed for a child's family, service providers, and schools to have easy access to the child to maintain stability and support for the child. Olmsted County Juvenile Detention Center has closed and is no longer operational. The only other options that are available for juvenile detention is MSC, our Minnesota Correctional Facility Red Wing, or several other metro providers. Request for juvenile detention beds in the proposed jail. Winona County Health and Human Services, Juvenile Probation, and the Assistant County Attorney Rebecca Church have asked the Jail Planning Committee for consideration of a few juvenile detention beds to be added to the proposed new jail. This request was made not to increase the number of children that are in lockup, but to assure the child's continuity of care. When the need arises for a child to be held in a detention facility locally, they will continue to have access to their mental health services, families, maintain their school, and there won't be a need to transport the child for court hearings. There is also support from Houston, Wabasha, and Fillmore counties for these juvenile beds for this same reason. Holding a child in a juvenile detention facility. A child is assigned legal representation immediately upon detention. A child is never held in a locked facility any longer than is necessary. Minnesota administrative law requires that a child must be seen by a judge within 36 hours of being placed in a locked facility, excluding weekends and holidays. After the initial hearing, the child needs to be continue to be held in a locked facility in front of the judge needs to be held every 8 days. The child is required to be in attendance at the hearings. So a child is transported from their placement to Winona and then back to their placement. If a child is placed in the metro, they can spend up to 6 hours in transport every 8 days. And then I will end my presentation, and we will wait for questions at the end of our panelists. Thank you.
Thank you, Karen. Next, we will have Sheriff Ganrud and Chief Deputy Mueller talk, and I'm sure they figured out how they're going to talk between the two of themselves about the jail, the condemnation notice that we received, and some of the transport issues before we get to Steve Buswell to talk about the jail project. So Sheriff Ganrud and Chief Deputy Mueller, you've got the floor.
Thank you. I want to start out. I started in law enforcement in 1980 with the St. Charles Police Department. I had no idea at that time that our jail had recently been opened. I came to the sheriff's office then 6 years later in 1986, and obviously I've been with the sheriff's office ever since. I've been involved in 3 jail studies. The result of each of those studies was a recommendation of the county board to build a new jail. This third time around for me, we're getting there. I became sheriff in November of 2014, so I've got 6 years as sheriff and 30-some years with the sheriff's office. When I was elected sheriff, I worked closely with the Department of Corrections and the inspector. And actually, while chief deputy, I was the jail administrator for just a short time. So I got quite involved with the jail at that time. I was surprised when the DOC, the Department of Corrections, came in and downgraded us to a 90-day facility. We'd had discussions for years, obviously, because we had all these jail studies, but it was surprising to me that they did that to us. But then I was even more surprised in 2018 when the Department of Corrections came in, did our inspection, and told me and Jail Administrator Steve Buswell that they were going to be sunsetting our jail. They gave us a closing date of September of 2021. Seemed like a long time before they were going to close us, but that time has gone extremely fast for me and the rest of my staff. So we had received in September of 2018 a letter from then Assistant Commissioner Ron Solheide. I just want to read parts of that letter, not the whole thing. Sheriff Ganrud and County Administrator Fritz, I would like to thank you for taking the time to meet with Inspection and Enforcement Unit Manager Tim Thompson and Detention Facility Inspector Jen Pfeiffer on Friday, August 3rd, 2018. The meeting was precipitated by significant and serious concerns with the condition of your current jail facility. After completing a tour of the facility, Mr. Thompson and Inspector Pfeiffer discussed the numerous physical plant issues that continue to be problematic, which also caused your facility classification to be reduced to a 90-day lockup facility on October 1st, 2016. Since that time, there has been little progress towards compliance with the Chapter 2911 rules. The facility was built in 1978, and the design is primarily linear type jail. Due to the age of the facility, many of the Chapter 2911 rules that are not in compliance are directly related to the physical plant conditions and limitations. The National Institute of Corrections has indicated the life expectancy of a facility that operates 24 hours a day, 7 days a week, is approximately 25 to 30 years, depending on facility usage. The Winona County Jail has been in operation at its current location for approximately 40 years. During that time, there was an expansion of the minimum security dorm unit in 2006, which has increased the use of the facility over the past 12 years. This expansion was a short-term solution designed for minimum custody beds and does not provide for the type of secure beds the facility currently needs to ensure proper separation of inmates based on security classification. Consequently, the county is still in a position to having to board inmates out with other counties. And just in addition to the facility being beyond the average life expectancy, the jail also lacks adequate recreation, programming, medical, booking, housing, and other functional space required for facility operations. The lack of adequate housing space, coupled with higher population, significantly impacts the ability of the facility to meet the requirements of Chapter 2911. They specifically brought up very poor sight lines, lack of security interlocks and sally ports, aged infrastructure, lack of storage space, undersized booking room, security garage, and visiting area. We have no sprinkler system on the main level and no staff bathrooms. They go on to say these deficiencies negatively impact facility operations, the safety and security of the facility, the staff, and the citizens of Winona County. They then gave us the sunset authorization with the date of September 30th, 2021, signed by the Assistant Commissioner. With this letter then, I had conversations with Tim Thompson, and I told him, quite frankly, that I was surprised that they were coming after Winona County because I thought they would go to Fillmore County. I recall him saying at that time that, well, you have an average of 50 inmates a day. They only have an average population of under 20. So that's why they were coming basically after us. Our last jail study was a reflective response to this issue, the closing of our jail, but it was not driven by emotion or urgency. Instead, it was done by a rational evaluation and research. The group has used logic, analysis, and reason to make their determination to the county board. The county board has voted to proceed with building of the new jail. They directed us to look at the cost and feasibility of a 78-bed and a 98-bed facility. The county has hired an architect and a construction manager. We have been moving forward with this project. We need to continue moving forward and not reverse our course. We do need a new jail, and I would just say that from my perspective as Winona County Sheriff, by statute, I'm obligated to take care of the citizens of Winona County, but the inmates that we oversee and everyone's safety and security is my main focus. Having a new jail would provide the safety to the staff, to the citizens of Winona, and the inmates that, again, I'm responsible for, Winona County is responsible for. And I'd just like to have Chief Deputy say a few words now too.
Thanks, Sheriff. As the Sheriff said, my name is Jeff Mueller, and I'm the Chief Deputy of the Winona Sheriff's Office. I've been with the Sheriff's Office for 23 years. I've been the Chief Deputy for 5 years. I'd just like to thank everybody who's participating tonight in one way or another in this forum tonight to try to gain some additional information. It's been an ongoing goal and effort of the Sheriff's Department to try to connect with the community to get information out about the Winona County Jail. The Sheriff's Office, as well as other justice partners, have participated in a jail action committee over the last year and a half, made up of 24 members, several from the public, in which all meetings were open to the public and covered by local news. Justice partners have also held in-person forums at the Winona Middle School with information and questions taken directly from the public. There's been numerous civic group meetings like the Chamber of Commerce, Eggs and Issues, Masons, Squanas, Lions, Township Officers, Faith Formation Groups, civic organizations, and Winona City Council and other organizations and groups to try to get the information out about the jail project. The Sheriff's Office and partners have made ourselves available to local media outlets for interviews and answer questions and have dialogue related to the jail project. The efforts tonight will hopefully be a continuation of those efforts to provide as much accurate and relevant information to the public and to answer questions related to the jail project. Thanks for the time, and I look forward to the dialogue with the community members and other partners in this project tonight.
Thank you, Sheriff Ganrud and Chief Deputy Miller. Our next speaker will be Captain Steve Buswell, who is the jail administrator and also the new jail project manager coordinator. So Steve, if you want to take it away.
Absolutely. Hope everybody can hear me fine. Yeah, I'm getting the nods of yes. Well, everybody, I guess a few have introduced themselves. I'm going to do it too. I think actually probably the vast majority have probably already met me or have known me or have seen something on a presentation. I'm usually the face of the presentations going around town for about the last year. I was born in Winona, raised in Winona, went to public school here in Winona and St. Mary's University. I worked at the Winona Hospital for 10 years as a float EMT orderly. I was an EMT for over 30 years, working on the ambulance service and then volunteering and also teaching other departments EMT, how to become an EMT or recertify them. And when I was working at the hospital, I actually then started working here as a transport officer in the Winona County Jail. Sort of like Ron, he planned on going to law enforcement, though. He might not have planned on coming to the sheriff's department, but he planned on coming to law enforcement. I totally planned on being in the medical field. This was not my destiny as a 18-year-old, 19 and 20, and then 21 and 22-year-old guy. This career found me, and I found it. So usually during these presentations, I want people to definitely know that the concerns and the interests that they definitely have is heard by everybody, the sheriff, the county administrator, the chief deputy, obviously Karen Sonneman and Karen Sanis and everybody else. I've worked here at Winona County now for over 33 years, full time. I started at transport. I worked as an inline detention deputy, was blessed enough to actually get promoted into a jail program coordinator. And then eventually in 2002 was blessed and became the jail administrator for the Winona County Sheriff's Department. And the reason I'm saying blessed is that there's a lot of people that can do these jobs, but there's only certain kind of people in certain kind of positions that are willing to try to do things that are right. And I think that Winona County has a lot of people in a lot of positions, and the ones I just got done mentioning, that do go against the grain and do try to do things that are right. Not necessarily what's been going on for 10, 20, or even hundreds of years necessarily. Because when I became the program coordinator, I actually went back and I started testifying at state capitals and talking to them about how jails don't have mental health. They're not mental health facilities yet. We're housing people with mental health. To be honest, I sort of felt that legislators really didn't hear me very well. So then I started calling the legislators myself personally and talking with them. And it wasn't really too long ago that there was a legislator, Al Franken, that got the ear of not just myself by any means, but our Criminal Justice Coordinating Council. The whole council got together, and Winona County stood on our bandwagon to say that this is really the kind of system that we need to have. And it's not a community collaboration, but it needs to be rather a national collaboration and going to the states where this is how we should treat people and this is how we should do things. And it definitely needed to start with some kind of a crisis response team, which Al Franken actually helped start in this area. But it started with us and our visions through Criminal Justice Coordinating Council, like Karen and everybody else has said, started back here in 2007. I believe in the criminal justice system. I believe in our Criminal Justice Coordinating Council as a strong supporter of community collaboration. Back in 1994 and 1995, I still remember the sheriff telling me when he was sitting at church one day, and I went to different churches around Winona County, not just the city of Winona, but entirely all around Winona County, to talk to the groups of people inside of the churches to let them know, hey, do you even realize that you have a jail here? And what happens inside of a jail, and it's a snapshot of what goes on in your community. And most people, hate to say it, really didn't care. They just thought, jail does what it does and it takes care of bad people. Well, no, it takes care of everybody that comes into that facility. And what I was trying to get was community connection and trying to get some kind of community assistance. And I always felt that the jail was siloed. It was completely siloed from the rest of the communities and even other entities inside of our community that were even private entities. And I felt truly that there was no actual baton passing, meaning if a person came into this facility here and they had a mental health issue, I wasn't able to reach out to whatever community connection, whatever department, and actually find out about this Fred Shapipic coming into the jail and being booked into my facility. Nor was I able to really be able to pass that information back on to anybody. And I thought, well, this is a bad mistake. This is bad. So what did happen of just starting with community connection was back in 1995, there was a guy named Deacon Justin Green that actually got a hold of me, came here to the law enforcement center and said that he was told to come down here, that there was a public outcry, that there was some assistance that was needed for coming to the law enforcement center and getting community connection. And I really feel that that connection, not me by any means, because it's not me, I might have had a vision, but there are so many players in this thing, from social services to private vendors, the Winona Hospital, Hiawatha Valley Mental Health, Winona County as a whole for social, the social services. Obviously, Karen Sonneman as a prosecutor from the county attorney's office to not always look at things on a criminal behavior, but rather what's really needed as a whole to take care of the situation and not have it repurpose or come back up, or what most people usually refer to as recidivism rates. How to reduce these recidivism rates? Well, you got to look at the whole pie, not just a piece of it. It's pretty easy to just sort of throw things away like garbage and then all of a sudden complain about your water's contaminated. I don't know how it happened. Well, we've just been throwing it away for years. So in 2007, Winona County stopped throwing it away. We actually started responding to it and started responding to much better practices of how we were doing things. That connection with Deacon Green actually started spearheading, making connections with the internal departments of Winona County, and then externally outside of Winona County to the Criminal Justice Coordinating Council that was eventually created. As Karen indicated, we reached out to National Institute of Corrections, which is a neutral party. They come into this county or any other county and they'll view the system. They don't care. They're not going to look just at the jail. They're not just going to look at the arrest. They're not going to blame law enforcement or anything. They want to see what's working well and what's not working well. And that's what the report's going to be on. Every one of the reports coming back from the one that I recall right around 1999 from Robert Gibson, the very first one, actually stated that the systems, even before we had Criminal Justice Coordinating Council, that Winona County worked very efficient and very effectively together. But if you remember what I just got done saying, we were looking at community connection. He indicated that Winona County worked very efficient and very effective together. We needed the community to work very efficient and very effective together. So that was the next biggest jump that we really needed to do. And that the jail was overwhelmed, because then right around the year 2000, we had a 35-bed facility with over 60 inmate daily populations. Other jails were actually busting at the seams. We were busing people, taking people to Candioi County, to Wilmer, to Duluth. And just like the juveniles, like you're saying, they have this seat time for the transports. We were going all over the place. And unfortunately getting into accidents and stuff like that too. It wasn't a very good public safety factor to look at. So we did look at building a new jail in 2002 and 2003, and then went with the avenue of building an annex downstairs, which I'll get into and describe a little bit of the outlays of that kind of stuff. The purpose of that was, again, to try to have community connection though. So as I get into these presentations, I hope you don't think I'm trying to sell you anything. I'm just trying to tell you what we've did over these my 33 years sitting inside of this jail. CJCC is about diversion. It's about reducing recidivism. And it's about helping get people back on their feet. CJCC can't do it by itself. The county can't do it by itself. An individual can't do it by itself. The community has to do it as well. And sometimes the jail does play a role in that. It puts someone in a safe place until the best option can be figured out. Because in my career, there is people that have come into this facility that weren't stable. They weren't in a good place. And when they left here, we are stabilizing them and we put them into the best place that we possibly could. With the assistance of RAP Plus now, you're looking at helping people with housing, medications, counseling, medical, working at getting their driver's licenses back, and obviously drug court and veterans court are two huge things of diversions for Winona County. Before I actually get into the true presentation, which I'm sure is what most people want me to do, other counties have come to Winona County. I'm actually going to brag about Olmsted County has come here to see how our Criminal Justice Coordinating Council has come. A much bigger county, to see how we actually work so well, to see how diversion and collaboration works together. To not only reduce the number of beds, but really what's happening to the person after they leave this facility, this jail. And more so that they're actually a better person leaving it, that they have some options, that some people can't even afford medication. So we've actually gotten their medications. We make sure that it's safe, make sure that they're not just going to overdose on it, and try to work with different entities, whether it's a private vendor or social services or whatnot. Inside of the jail, staff's been trained more on crisis intervention. We're much less hands-on, much more mouth-on. Mark Twain said it the best way. He said it a little bit different, but I like to rephrase it this way. The difference between the right word and the almost right word is the difference between lightning and the lightning bug. What we say to someone and how do we respond to someone totally makes a difference. And that is jails nowadays. That's how we respond to people, and that's how we work with them. Most of the people coming into the facility are not murderers. They're not the world's worst, but usually they're not in a good place, and they're not of good behavior. And the jail is all about trying to change that behavior. We do have medical here 3 times a week, a registered nurse, and we also have twice a week a social worker. True bodies here that are actually able to see people. If we have to, obviously we're going to transport people out for medical or anything that's an emergency or whatnot, or even have that happen prior to even them coming to the Winona County Jail. So that's just a little bit about me, and I'm going to try to share this. I hope it worked. Did I do the wrong one? Can you see it or no? Can you share? Can you see my presentation?
We can see it, Steve. Might make it a little bigger, maybe, but
change screens. I have it big on my right screen, but not on my left screen. I'm not sure.
Click on display settings, Steve. Up at the top, to the left.
To the left. Oh, found it.
Click on that.
Okay.
And then swap view.
How's that?
That looks great. Thank you.
No, that made anybody that's challenged with electronics much better, much more comfortable. So what I'm going to start off with is everybody, I shouldn't say everybody, I've heard people talk about oversizing a jail or making it too big and whatnot. So the presentation, I have to be able to go into what's considered an optional or a proposed or the potential of a future style type jail, and then actually go back in time and talk a little bit about the 1977 facility or the current facility that we are in. So I will refer to it as either the 1977 jail, current, or sunset jail, because one of the emphasis needs to be made that in September 30th of next year, the current facility that we know of as the Winona County Jail will not exist at all. So if there's anybody that is taken into custody, unless there is something that is progressively moved forward on, we will not be able to house anybody in this brick and mortar anymore. So to look into the future, it's about having options. If you look at this jail housing design, I wrote 1, 2, 3, 4, 5, 6, and 7. Those are 7 different pods or 7 different housing areas. When I get into the current jail or the sunsetted jail, the 1977 design has actually 7 different cell blocks to it. They're called pods now because they're designed a little bit different and, well, considerably different. The different design is actually more to be similar to what I like to say, either a traffic control tower at an airport or an intensive care unit at a hospital. They're specifically put in strategic spots so you can get the best view bang for your buck, meaning the best observation. So our current jail does not have that. It's a linear style jail, which means staff are constantly outside of the housing units or the cell blocks, and they walk in to do mandatory well-being checks at no greater than 30-minute interviews or intervals and staggered. So they have to walk into those units. They walk around to make sure that everybody's fine or someone's not taking advantage of someone or someone's not having a medical issue and so on. In a unit like this one or a design like this one, even though they're not right in it, they can see this 360 view all the way around them, just like a control tower, and have a very quick snapshot about what's going on inside of the housing unit. We'd also have, just like we currently have inside of our facility, a plethora of cameras. So each one of the cells that you see, day room areas that you see, housing units, or I like to call it a house rather than a cell. When an inmate or a detainee goes into their cell, I refer to that as a house because that's where they're actually housed while they're inside of this facility. And when they go in there, we're going to have cameras inside of those areas too. Obviously, they wouldn't have views of showers or bathrooms or whatnot for their privacies. The whole purpose of that is to help us view them for their well-being, safety, while they're inside of the Winona County Jail. So when I compare the old jail to this current one, and you're looking at 7 different housing units, and I go to the next one, this is a snapshot of the current jail, or what I like to refer to a lot of times, the 1977 jail. This was a typical kind of design that you're actually going to see from more of the 60s, 50s, or even older in jails. They're called linear style. Really where it's in the middle where it says jail and 7,958 square feet, the red that I marked on there is just to indicate that that's the hallway that the staff walks to then let themselves into those housing units. And here there's 1, 2, 3, 4, 5, 6, 7. A little bit of difference in between these 2 styles of facilities is block 1 in this one and block 7 are what's called dormitory. Those units have 4 bunks, double bunk, so they're 4 bunks up to 8 inmates. And what that means is who's ever in that unit has to not only meet separation and classification requirements, which I'm going to go over here shortly, they also have to be able to get along quite well with each other and good enough to where they're not a health, safety, or welfare risk to anybody else that's inside of that facility. So health, safety, welfare. Well, think of kids. So if you have 2 kids and they're not getting along, and whether they're verbally or physically fighting with each other, if you put them in a bedroom together, not separated, the likelihood is that they're going to continue to argue with each other or actually physically fight each other. As simple as it sounds, that's the same kind of mentality that happens when you actually try to do separations and then classifications in the jail to really figure out where you're going to be putting people inside of these brick and mortars. What actually works the best. So in a design of a facility, you need a lot of options, a lot of different options. So a phrase I'd like to really make sure that's known tonight is a full jail is not, it's absolutely not a safe jail. So if someone comes into this housing unit, block number 1, and is a sentenced female, could be a sentenced male or female adult, for anybody else to come into there, they'd have to be able to meet that classification of another adult sentenced and at least sentenced, and then we'd start to look at other notations to see if they're actually going to be able to like meet the classifications to be together. So part of it is, do they have a physical disability? Do they have a mental disability? Do they have a learning disability? Do they have anger management issues? Some people just go off on a snap of a finger because they're frustrated with just about anything. And if people are ever inside of a jail, this isn't necessarily the quietest place always in a place, or excuse me, of all the places, so people can get really frustrated. So again, where are we going to put them inside of this facility? Looking back at this one, options of it, if I was just to use whether it be cell block 1 or cell block 7, and the reason I'm picking those is they have lower numbers of beds that are available inside of those units. What they do have, or what we would have as an option in a newer style jail like this, is you'd be able to lock somebody into one of those houses, what I call a house. Usually the Minnesota Department of Corrections, everybody else calls them a cell. So the good thing about that is if someone's not getting along good, I could actually put them into their house and secure them inside of that area. But I wouldn't want to do that long term. So what we did add inside of a facility such as this one, if you look at the day areas, such as block number 2, and I'm using, hopefully you can see my mouse spinning around. There's a sub day room in there. Whoops. A sub day room in block 2. Block 3, there's a sub day room. Block 4, there's a sub day room. Block 5, or pod 5 and pod 6 has a sub day room. If someone's not behaving, doesn't need to be so-called disciplined, they're just not getting along with somebody else, they can actually go into those sub day room areas into another house, still have their own day room behind that door, and be completely safe from any kind of harm or any kind of harassment from another inmate. And it might sound like a lot, but it gives a lot of options again to the Winona County Jail that we don't have. We have currently right now upstairs 7 different units. The facility that we're looking at is to have 7 units. In 2005, when we looked at trying to, how do we keep as many inmates or anybody here that's either sentenced or pre-sentenced, pre-convicted at the Winona County Jail, especially to try to get them into the programs with Community Connection. We were the first jail in the state of Minnesota to have an in-house, not a treatment attached to it like people were coming in, an actual in-house where the Winona County Jail was certified to have an in-house patient treatment, knowing that some people do stay here for an awful long time. And we lost that. And what happened to it was we were shipping our long-term, our longer inmates that stayed out for a greater period of time to Goodhue County. They were the only jail that was able to take overflow, extra inmates. So that program actually left our Winona County Jail and went to Goodhue County. So unfortunately, we went back to sort of more of an old school where it was difficult to get people treatment inside of the facility because they weren't staying here long enough. And that's not our intent, is to leave them here for long periods of time. But if they are to stay here, again, another phrase that I used to have when I was a program coordinator was doing time doesn't mean wasting time. We shouldn't be wasting it. There's something that we can have them do, something that we can have them to better themselves when they get out of the facility, whether it has to do with just self-help, mental health, medical. We worked with social services to try to get programs in here where they could actually meet with their children. And I mean, we're still going back 15 years ago, and now the federal government is looking at having requirement for programs such as that in all jails. So we are sort of spearheading or trying to do things outside of the box for an awful long time. So comparing that snapshot to this snapshot, 7 cells, 7 different units, 7 pods. So I hate to keep jumping back and forth. Then we added to the Annex in 2005. There's 5 dorms down there. So the Winona County Annex was built and opened in 2005. We went from essence a 35-bed facility to an 83 total bed facility. So total bed is important to understand compared to how you're going to manage inmates. Because like a motel, it's not good, again, to be full in a jail. You want to have options. You want to have options to be able to move inmates around, or like I call actually detainees moved around. If they're not getting along, I need a place to put them. I need to be able to separate them. Going back to the kids, I can't put them in the same bedroom or the same housing area, because if they get into a confrontation or an actual physical confrontation, especially, their health, safety, and welfare is jeopardized. The Winona County Jail then is then actually responsible for anything that happens. The reason that I put up this screen, it's the old jail, just to remind us all that September 30th, 2021, this closes. That means we'd have nothing. So there needs to be a determination for sure of what we're going to be doing. How did we come up with this design? So how did we go from an old jail to a new jail, and how do we start thinking about how are we going to build the beds, and how did we come up with 80 beds, and how did we make these different pods? Well, we did it starting with the Minnesota Department of Corrections rules, the rules and regulations, which are, there's a statute 241021 that says basically in a nutshell that the Commissioner of Corrections shall, at a minimum, have a set of rules. And these set of rules are called 2911s. And there's 0100 to 7600. And what they do is they go through, and there's essential and mandatory rules. The one that I have up right now is the mandatory rules. It's not an option. You have to follow it. You have to do it, which is separation of inmates. You cannot combine a male and a female. You cannot combine a minor or an adult. You have to make sure that someone who's a vulnerable adult or has a serious mental health issue, or even MRSA, or a health risk to other people, or as today, as we all well are aware of and afraid of, is COVID, put them just in a unit to have that congregate facility, it would spread like wildfire. So you have to have a safe place to be able to put these people, and then have HEPA filters inside of these facilities, which, by the way, the current facility doesn't even have anything like that. We don't have negative pressure system except for what's related to just fire. We don't even have a fire suppression system. So nothing to put out the fire with a fire suppression system. We're not ADA compliant. We don't have a HEPA filter system inside of here. So that's why it's very difficult to even, and actually scary, to have anybody inside of this Winona County Jail right now during this pandemic. I would correlate it with, unfortunately, like the nursing homes around here. I don't want to make a comment on the specific name, but there's a nursing home that unfortunately was gravely hit. And that hits home with me because it was actually a friend of the family's mother that actually died of COVID inside of the facility, of how rampant and how fast it went through that facility. If something like that was to come to this jail, the same thing potentially could happen. So that's why we did what we did as far as looking at a system to reduce numbers of the possibility of having anything potentially happen inside of this brick and mortar. So separation. So to continue the separation of the inmates here, we put people on a 14-day quarantine. The reason why is there's a lot of mixed statements of the government and whatnot of what specifically is a time that would be safe to let somebody out. But nothing was ever unmixed of the 14 days. So we stuck with one bird in hand to make sure that if we quarantine someone in 14 days, eventually Minnesota Department of Health provided kits to congregate facilities such as jails. We took advantage of it immediately and started offering COVID tests to both staff and inmates inside of the facility to see if they either were positive for COVID, whether they were showing signs or symptoms or not. It was voluntary. We can't force them into it, but we're doing those tests. After 14 days, if they still remained inside of our Winona County Jail, we took them out of the confinement to what I'm going to say, isolate them from anybody else, quarantine them, and then unquarantine them, allow them to be with other people. That's a little bit different than what I typically talk to you about when it comes to a jail. So this pandemic totally changed how we're doing things. But what it did is it completely made it almost that we were separating everybody and classifying to the best of our ability, absolutely. But it became such a paramount factor that we made sure that we were looking at everybody as potential contamination coming into the facility to not contaminate anybody else. So we wanted their health, safety, and welfare to be premium. So on top of that, we also purchased, the county did as a whole, purchase these, what you see if you ever watch the airlines, they're always spraying down their airplanes all the time with these, they basically look like giant water guns, and they spray a propellant, a disinfectant, not a cleaner. This is a true disinfectant that will absolutely kill COVID, and it's electrified. So with the electrification, it can cling itself onto anything, including a computer screen, won't ruin it, but it'll completely clean it within a minute, meaning disinfected within a minute. And we do that every few hours inside of the Winona County Jail. Anytime that there's an inmate transport or coming in or out of the facility, if one comes in, another one's coming in before that next detainee or inmate comes through the facility, or even the booking room, that's cleaned right away. So we took this very, very serious. So the state, though, on a normal jail says a combination of separate housing units inclusive of maximum and minimum security areas and cells, detention rooms, dormitories, and day areas, spaces shall provide properly segregate inmate pursuant to Minnesota Statute 641.14. So that just means that how we put people and where we put them has to make sure that they're safe. It also goes on to say that the sheriff shall, it's not an option, but shall maintain strict separation of prisoners to the extent that separation is consistent with the prisoner's security, safety, health, and welfare. That's why it's so important to really understand in a jail, unlike a motel or anything else, it is not good to be full. A full jail is not a safe jail. In some presentations quite a while back, even when we first opened up our annex in 2005, they used to tell the public quite frequently that if you walk into a motel room, or excuse me, any motel, not a room, but into a motel, and it's full. Some rooms have single beds, some rooms have double beds. But they don't say, well, I can offer you this other bed over there, another family, another couple's in it, but there's that other bed that's right there. There's a reason for that, because they have to make sure that there's that, maybe someone wants to do it, but it's all about the separation of the people and making sure that their health, safety, and welfare is taken into play as well too. So a motel room is about money. The fuller it is, the better it is for the motel. They don't have to worry about separating people if they don't want to be separated, or if they don't have to be separated. Again, the premier requirement from us, from federal level and the state level, from the Minnesota Department of Corrections, is that we have to assure health, safety, and welfare. We have to be firm, fair, and consistent all the time with everybody coming in here. We do that through separating them and keeping them safe of minors and adults, males and females, which then leads us into the classification, which is an assessment of the inmate, another mandatory. So this falls under 241.021 and another 2911. This one's 2600. Depending on your facility, you're going to have a written policies and procedures. Each jail has a similarity to it, but each jail is different. And the reason it's different is because they're going to have a different brick and mortar design. So how you're designed with it is how you're going to operate it and how you can actually use that facility effectively. Some people just built specific medical units. Some people built very specific admin disciplinary segregation units. Some people have special management as far as if someone comes in and they're a predator or a murderer or just an anger management kind of person. They have those special units already built into it. This jail design, this concept that we're looking at, utilizes those 7 different housing units, those 7 different pods as options. One can be one day, one can house females, the next day could house males, the next one day could house pre-sentence, pre-convicted people. You could switch people around and put post-conviction people into it if all of a sudden you start to see your inmate population start to increase for post-convictions and people going out for work or serving what we call straight time, which doesn't happen very much in Winona County. They usually get them out. So after the policy is done, you have to take a look at whether they're minimum, low, medium, or high, or even administrative segregation, which I'll talk on the next slide, of custody required, and then find them a housing assignment, and also look at participation in facility programs, which were all about programs. And when I first started here in the jail, programs was AA, Bible study, and GED. And GED left awful long time ago because it was a cost to a school district. And then we got it back and we lost it. And the reason that we lost it, because again, anybody that was here for any length of time to be able to utilize GED was in another facility, because this place either wasn't allowed to house them anymore because our classification was changed, or we weren't able to keep them here because we couldn't maintain separation / classification inside this facility for health, safety, and welfare factors. So when we're looking at a classification, in a nutshell, we're looking at inmate gender. There's more than this, but sort of like others, if you know me in a presentation, I can talk all night. And this is a passion for me in the jail, and I would like to talk to anybody well after this, meet with anybody, make another presentation if you want me to as well. But then you look at adult versus juvenile category of the offense, predator, age. It does make a difference whether you have a younger or an older person that's sitting inside of your facility, just because of the way that they act. You obviously have to look at escape risk. You can't think of the murderer way back when, but something Donald that escaped from the old Winona County Jail, which was about 6 feet away from this building right here, by literally going right through a window. But escape risk nowadays is about, people that are in custody that are hopeless and helpless and don't really feel that they don't have any avenues really to go. And that's what we're continually trying to take away while they're inside of the brick and mortar of this facility. The other risk of a safety to others, meaning, do they have a serious drug or alcohol use? Do they have special needs assessment? As Karen Sanis was talking about earlier, we do a brief mental health history. We're not social workers. We're not high-level trained crisis intervention people either. We are correctional staff that are trained in this stuff, but we definitely get a really good snapshot when someone's coming into our facility to understand where they're at. But that snapshot's also only as good as they're honest to us up front. Now, as someone keeps coming in and out of a facility, whether it's Winona County jails or somebody else's jail, and we're able to get those histories, part of it comes from criminal histories. So as the county attorney stated, the ones that are looked at that have a high probability of, or committing a crime, or that has that criminogenic kind of background, which is the causing or likelihood of causing a criminal behavior. Just like you could have that for homeless. You have certain kind of criminogenic behaviors for homelessness that keeps you out in that kind of a level. We like to look at that, because if we can figure that out, that's a huge stepping stone for us to work with social services, the prosecutor, the defense attorneys, and then obviously the community, to try to find the resources. And for us, the jail, the initial resource is the RAP Plus program. So what can we do for housing? What can we do for your mental health status? What can we do for your behavior? And what's that initial step? Those are not long-term, things that are going to continue on. These are short-term, because they're specifically coming from either a grant or, the county. So
Steve, can I interrupt you? We're getting into our question period, and we've got a lot of questions.
Okay, I got a lot to do.
So,
okay, I'm gonna keep going. All right, I told you I like to talk. I don't know.
We know that, and it's good information.
Okay.
But yeah, okay.
So the next part about classification and mandatory is a snapshot that we look at as past behavior, current behavior is a prime indicator for future behavior. How do we do that? We do that through criminal histories, past intimate knowledge of the offenders, whether they're drug use, alcohol use, mental health, medical behavior characteristics. And based on these known traits and tendencies, we do the best that we can from knowing this person and getting the background of where we're going to put them in between meeting the combination of separation and classifications. By meeting it, that equals safety inside of these facilities. So we're not just putting people in a place to put people in a place. Two people might have the same charges. They might have the same level of criminal histories. They might have they look like they belong perfectly together in a unit, but their behaviors are this. there are two strong people and all they're going to do is butt heads, and they're just going to cause nothing but disruptions and eventually either get the unit going negatively or start to fight each other. So we need to separate them and move them on. Then there's the administrative segregation, like I said, I would talk on. So segregation is when it's necessary to protect the inmate or others, staff, volunteers, and medical from other inmates. High profile cases. A murder is usually typical, a great one to bring up. Someone commits a murder, potentially commits that murder. They're not guilty of it. But if they're charged with it, and if they did it, and if they're looking at going away for an awful long time, if they kill somebody else inside the jail, a jail staff or another inmate, they're really looking at no more other time. They're on the one murder on top of another one or a serious assault. They really don't have a whole lot to lose is where I'm getting at. So those people you definitely want to have in a level of segregation from other people, sort of like the COVID people, to make sure that the objective is protecting the inmate, staff, and the public. And those public are also the volunteers coming in here for those GED bubble studies, and especially nowadays, people coming in that are paid professionals, because we are big into mental health coming into the facility as an in-house mental health. And obviously their attorneys come into here too. So when attorneys give them bad news, we want to make sure that we have a secured location for them to actually meet with their clients. The current one doesn't provide that at all either. And that was one of the reasons why we're sunsetted. Average daily population. So how did we come up with these numbers and 80 beds and so on? And so average daily population for the last 4 years, including 2020, this COVID year, is 44. So the sheriff mentioned that our ADP was 50 earlier, and he's accurate. So pre-COVID, we actually, going back even before 17 stuff, we had years that were much higher than 50. But we're just taking an average, and our 50 average daily population means that at a snapshot throughout a year, we could have had a 60 or 63 bed population, and we could have had a 43 or whatever that was in between there. The average daily population ended up to be 50. If we only took a COVID year of right now, what we'd be looking at is a population, of 26 average daily population. So what's important about that is the criminal justice system as a whole really put the brakes on everything. So as I mentioned, since we're a congregate facility, we really were worried about staff, the system and stuff really getting sick and potentially people dying inside of facilities, that it's hard to get out of it once it gets into it. And we're still averaging 26, or about approximately just a little bit more than half the inmate population that we always do. So definitions. And again, sorry for taking so long, but design capacity is the number of beds in a facility approved with the addition of holding cells, beds, and designed for administrative or disciplinary purposes. It's the total beds built. So in 1977, our total bed capacity in the old facility, or this current one, was 35 beds plus one holding plus one isolation cell, 37 beds. The approved capacity is the number of beds determined by exclusion of holding, design, administrative or disciplinary purposes. The total beds for classification. Well, we took out our holding, we took out our isolation, we had 35 beds in the old facility. Then the operational capacity is the percentage approved of beds to accommodate the peak population demand, separation, partial closing for maintenance and housekeeping. There's one thing that people sort of forget. When you see a 20-year-old facility, a jail, you think, well, it's only 20 years old. What's wrong with it? Well, it's 20 years old times 3. Any other building typically is used 8 hours a day, Monday through Friday. The jail is used Monday through Monday, 24 hours a day, 365 days out of the year. So by use, the facility is actually used-wise 3 times longer than any other use. So by opening and closing doors, walking on the whatever flooring that you have, the paint that's in there, the toilets that are flushed, the light switches that are used, they're used 3 times as much. So there has to be a maintenance plan and program to make sure that you can maintain those things to make sure the facility keeps on running. So in our facility, the current jail, what I'm gonna say, before we added the annex, was 28. So 28 out of the 37 was our operational capacity when we opened our door and we became a 1-year facility back in May of 1978. So how do we have 80 beds in a facility and how do we work it? Well, first of all, we have to start to look at, like on these 7 pods, one female comes in, she gets placed into pod number 7 and is booked. If there's only one female inside of that unit that is kept, that one female, that one pod right there has 6 beds to it. So there's 3 cells in it, 3 houses, but each one's double bunked. So you're actually taking up 6 total beds with one person inside of it. So to maintain separation and classification, it's starting, I hope it's starting to get easy to how you understand why you need to have options inside of a facility. And any other person in this pod must be female, meeting the same classification, that assessment, as that first female coming into it. So either pre-sentence, pre-convicted, or post-conviction. And my illustration here is just to show how quickly a cell or a pod can actually change. Looking back at classification, separation, category of offense, escape risk, risk to safeties and others, special needs, must place them in a location not to take advantage of anyone or to be taken advantage of. So again, you have to look back that I wrote on here PREA. PREA is Prison Rape Elimination Act that was enacted under George W. Bush back in the early 2000s. And it was to actually make sure that any inmate didn't pick on another one, either by inmate to inmate, staff to inmate, or even inmate to staff. So if one inmate was making a comment to another inmate, or as I like to call them, detainees inside of that facility, that person would be obviously pulled out of that unit and separated from someone else, so it can be thoroughly investigated just to make sure that it was a PREA violation or wasn't a PREA violation, and then handled accordingly inside of the facility. If it's just 2 people, like someone just is messing with someone, the potential of being able to put them back in that same unit could happen, because in this unit right here, we're looking at in 6 and 5 had those sub-day areas. So we actually could separate them and put them inside of it. Best option would be just to move them. But again, it means that you're taking someone from one unit and needing an option of another, i.e. the 7 different housing units. Just want to reiterate again, a full jail is not a safe jail. Motel rooms and number of beds in a motel, double versus single room. When we go around this jail option right here, the current jail upstairs has 35 beds. The downstairs jail has 48 beds. Those are total equal to 83 beds. All these housing units, whether in the old jail or the new one, only work as long as everybody meets the separation classification requirements. On top of that, double bunk cells can only work as long as both parties get along. We have to maintain that health, safety, and welfare standard. So, 80 beds. Well, if you look back at the sunsetted jail, as I've talked about, we have 83 total beds. There's 19 single beds in our old unit. So if I, sorry, go back into this one, there's 19 singles. So block 1 and block 7 are 4 bunks, remember, of 8 inmates. That's a dormitory. I can't separate them. I can't lock them down. If I'm going to have to do anything, I have to move that person out to somewhere else, male or female, that's going to work within any one of those other units. Inside of the current one right here, sorry about the movement. Inside of the current one, we're looking at 53 cells, 53 individual cells with an average daily population of 50. With 26 of those cells are going to be single beds, and 27 of them are double bunked. So the 27 actually becomes the 54. So 54 plus the 26 is 80 beds. But for separation wise, we have 53 individual separation housing beds. So our current facility has 64 double bunked plus 19 single beds upstairs, equal to 83. But if we just took that down to singles, that'd be 32 plus 19 is 51. Where I'm getting at is we stuck with the fact that the current jail has 7 housing units, and it was the wrong place that was built. We couldn't do sight sound separation. We couldn't move people around. We couldn't keep the health, safety, and welfare standards in check. So we needed to make sure to meet the current standards that we had to keep that in check. And by doing that, we kept the 7 current cells and went from 51 to 53 individual cells, and actually went down from 83 total beds to 80 beds. But in essence, giving us a much more sounder health, safety, and welfare standard to meet that inside the facility. With that said, there's no doubt that there will be times that during classifications, or like one year we had 3 homicide suspects arrested in the same year in Winona County. So those 3 individuals might have to actually be in different units or different areas inside of this facility. Even though, again, we might have some available beds, you have to take into consideration that new arrests, we have to have space for any new arrests coming into it, number one. Number two, health, safety, welfare, we still might be housing people out even with the 80 beds.
Steve, can I interrupt again? Sorry.
Yeah, it's yours. You can go ahead.
Yeah, it's,
Yep.
we want to make sure that we have time to answer all the questions. Well, not all of them, but many of the questions that have come in.
Yep.
And so perhaps some of these questions will trigger some of the additional information that you might be providing in your presentation. So I hope you don't mind if I start with the question period. So we'll extend it to the 20 minutes that we did say at the beginning of this forum. And I also want to note that, as we indicated at the beginning, the questions are being taken through the chat function. And the county board would be the decision makers here as to whether there'd be an additional, some kind of a public hearing type or event to take public comment on this. So that's really a decision for the board to make. At this point, we're providing an informational forum, and as I indicated, we're taking questions through the chat function. So let me start with those, and I'm gonna kind of combine some of them here, but let me start with Karen Sanis. I think this is one for you, Karen. There's going to be a new facility in Rochester, the Southeast Regional Crisis Center, set to open in Rochester. The question talks about potential for 16 beds available to the 10 county area. Are they distributed on a first come, first served basis? And how might that affect mental health treatment here in Winona County?
Yes, there is a Southeast Crisis Center that is in the process of being built. Winona County is a partner in that with the 10 county region. We've worked on this for, probably 4 or 5 years now, and it is really exciting to see it come to fruition. Yes, it is on a first come, first served basis, again, based on population, based on the individual's behaviors, the safety and security within the facility. They've done a nice job kind of with the design to be able to kind of do kind of what Steve has indicated, kind of, with the different units within the facility, to be able to kind of triage who's going to get along better and to be able to isolate individuals. So yes, this will be something that would be able to assist us with the mental health crisis services here in southeastern Minnesota. So thank you for that question.
Okay, and the next question kind of follows up with the mental health issues. I think I'll give this one to Steve. Does the jail or the detention center do mental health assessments on all inmates? And if services are determined necessary as part of this assessment, who provides those services? How many inmates currently require mental health services, and how many are actually getting those services?
Great question. The absolute number of people that are getting it, I don't know off the top of my head without actually going back and looking at the statistics and working with Advanced Correctional Healthcare, who's our provider currently inside of the Winona County Jail. So everybody that comes into the jail, anybody that's booked, anybody that is booked in to stay inside of the facility, because we do book and releases for court, make sure we don't have suspense files. And if they're staying inside of the jail, we do a brief mental health history, and it's sort of lengthy, but it's not a total assessment. But again, it's a snapshot to give us a view to whether that person needs to see medical or needs to have a a social worker actually come evaluate them. On top of that, when our bail evaluator comes in, part of that job of that person is again to look back into their history and make sure that we haven't missed anything. Because as I stated earlier in the presentation, people coming in are always really fruitful with us. They don't tell us the truth. And part of that is obviously we're looked upon as the wrong people. That, you know, society put them inside a jail and all that kind of stuff, and all they want to do is just be upset right now. So we understand that. So we have another avenue for that to happen. The average length to stay inside of the Winona County Jail is 10 days. We actually used to be 18, then it went down to 16 through CJCC, and now it went down to 10. Those are because we are doing the right moves, we are doing the right things. With that, it's very difficult for someone that is coming into the facility. Out of the average of 1,600 people that are booked in through the Winona County Jail, a vast majority of them are released within 72 hours. So very, very difficult to pass that on right away. And I hate to say it, but we can lead that horse to water, but typically what happens is we try to hook them up with the connection, we try to pass that baton. The person's more looking at freedom, just getting out, I just want to get out of there, and they go right back to their own connections. So without some kind of better support system on the outside, there's no doubt about it, but we're working on that. RAP is a huge proponent to that support, getting that assistance on the outside. But I know I haven't given a number, it's a hard one to give, but if I had to guess, I'd probably say 70% of the people coming through, 70% of that 1,600 people are needing assistance going through it. And then who really takes on it is a much, much smaller amount, because like I said, they're indicated, the majority of them are getting released within 3 days.
Okay, thank you. Kind of moving on to finance questions, things like that. Ken, I'll ask you, where did that one go here? Let's see. To date, how much has been spent on the new jail proposal? And one question that's sort of related, but or to you, Ken, is also the jail intake workers that paid for by the Justice Mental Health Collaborative Program grant, which I can kind of answer. It used to be, but it is now a county position. But Ken, maybe you can talk a little bit about some of what's been done and
Sure.
what's been spent on the new jail so far.
Actually, the county has spent a relatively small amount on the jail so far. When we did the jail advisory committee study, instead of hiring an outside consulting firm, which most communities do or most counties do, those projects can run in the six figures easily to do that kind of an analysis and study. The county board put together the jail advisory committee. I think there were 24 members on it. Some of the people on the panel were members at the time, other community members and so forth. We did hire a consultant, but we happened to be fortunate to have a local consultant that does work for the National Institute of Corrections. He's located right in La Crosse, Wisconsin, and he's worked with us before. So we were able to avoid a significant amount of the costs related to doing the study portion of a jail, relook at a jail. The second phase, the JDCC's phase right now, where we're looking at the jail design and construction committee, or that committee is working on things. We did hire an architect and a construction manager, but we've only been working on the schematic designs to this point, and so the amount invested in that is not insignificant. I would say probably in the area of $100,000, but we're just starting to get invoiced for that. The real money when you're talking about constructing a jail in terms of the physical plant and so forth is the actual engineering design, the actual drawings and so forth, and then the construction of the facility. Those things have not been started yet. We're only at the schematic design phase, which basically means things like the diagram that are on the screen here. These kind of things are what we're producing at this point for the county board to review the various options. So again, I don't have an exact number off the top of my head, but we've been really pretty frugal with that process as compared to some of the other jail processes we see in other counties.
Okay, Ken, while I've got you talking about finance, another question was, how much of the 25 million will be used to update the dispatch center and sheriff facilities? And then it mentions 5 million will be provided by the city of Winona to upgrade the police department. What will be the operating costs for the new facility versus the current one?
Yeah, actually, that there are a few assumptions in that question. Right now, the JDCC did explore a number of options. One was that incorporated the Winona Police Department need for additional space. Another was to talk about how we might handle juveniles. And then, of course, there's the jail itself and anything that's connected to jail, like the dispatch center and other parts of the LEC. After a lot of study and options and pricing and so forth, the JDCC is recommending at the next December 22nd county board meeting an option of, it's actually kind of on the smaller side of what the options were. We were given a mission of looking at either a 98-bed facility or a 78-bed facility. The group, and I have to give credit to those on the panel that were instrumental in putting together a smaller version that would meet our needs. And so again, less cells, less beds, and that's something that we're pursuing. So the 5 million for the expansion of the Winona Police Department has been set aside as a separate track, because that will take some time for the police department to determine, along with our architects and the county, how that might work in the existing jail facility. In other words, possibility of reusing the existing jail. The same with the discussion about juveniles. Again, that's been put on the side as well. So the recommendation that's going forward, just kind of in a nutshell, to the county board is to replace the existing jail facility by adding this 80-bed facility onto the current LEC, which basically locating it in the parking lot area and the new land that the county's purchasing. And then to go back, and if the board wants us to or desires us to, we'll look at what we could do with the city of Winona for their police department, and also if there's any option that includes that building for the dispatch center or anything else that needs to be addressed. There will be some things that are addressed in the initial jail plan that as it's presented right now. We do have to connect the dispatch center and do a few upgrades because it does serve as a central, controlling doors and so forth in the facility. And we have some other things we need to do. We need to connect the building to the tunnel that moves from the LEC to move prisoners from the jail to the courthouse. There are mechanical issues, generator issues, heating and air conditioning issues. So there'll be some revisions in the law enforcement center, but it's not a total redo of the existing jail at this time. So I hope that answers the question.
I think it covers a lot there. So
it's a lot to unpack. Yeah.
Yeah. Okay. Another question, and this goes to Karen Sanis, I think. How does the Health and Human Services Department ensure culturally relevant and appropriate services and assessments? And are the department services that you discussed available in a timely way to everyone who seeks them?
So, well, I'll start with the timely and relevant. So Winona County Health and Human Services does not have control over our private nonprofit agencies that provide the services. I'm going to be, they are the ones that set their rules and their regulations. I also do not control the diversity and inclusion and culturally appropriate services within our private nonprofits. I do not have any authority over them, but we do make that part of our contracted services whenever we can. I assure that within our Health and Human Services Agency to be able to provide culturally appropriate assessments whenever possible. I hold a certificate in through the Humphrey School of Public Affairs through Equity Works Leadership Institute. And I sit on multiple committees through the Department of Human Services to assess policy to assure that it is equitable before going into policy and procedure. So
Aaron, I'm sorry to interrupt, but you might mention our relationship with Project Fine.
yes, yes. And also we have a great relationship with Project Fine too.
I mean, they're actually located in our building.
Yeah, where we assure that if there is language barriers or cultural barriers within any cases that we have them readily available to be able to provide interpreter services. They're very responsive and very well respected within our communities of different cultures. So yes.
Okay, and yeah, I'm still, Karen, part of that question that I didn't ask you was, how do you, I guess, the department inform the community about the availability of these services?
We try as much as possible to be able to provide these throughout the community as much as possible. Where there's several resource directories that are available through Engage Winona, Live Well Winona, that are out there that do list these services. We do make them available, you know, with our different service providers. So if anybody has contact, let's say through a therapist, that they are able to provide that. We're working with Winona Health and Live Well Winona on our Community Pathways Hub, which is a community connector that can go out and meet with individuals that know the resources within our community. Winona County also houses 2 individuals that work with our families that typically have younger children in their homes to navigate those services. So we're really trying to increase that access to services and know what is available out in the public. And we try to maintain our website as much as possible with the most up-to-date information with services that we do offer at the county.
Okay, and hate to keep giving you questions here, Karen, but you've got quite a few. You had mentioned readily available support services that the Winona community has to offer for high-risk youth and adults. The question is, what do you define as readily available? What's the wait list for the children's psychiatric provider, as well as the wait list for adult psychiatric provider?
Right.
And kind of just the general wait list for some of these mental health services for people.
Yes. So, you know, I'm sorry if I gave the depiction that it was quick and easy access and everything is readily available. This was a high level overview of services that are available within our community. Each service has its own guidelines and regulations for qualifying for that service. And so that is something that has to be assessed. I see that there's several different agencies that are listed. Again, I don't control how Hiawatha Valley does their intake. I don't control how Legacies does their intake. What I do want to comment on is that our psychiatric services are in crisis right now, and this is not just in Winona County. This is throughout the entire nation. We have a significant issue with psychiatric services. Our Centers for Medical or CMS, Centers for Medicaid Services, does not provide adequate reimbursement for psychiatric services. So just to have a prescriber or a psychiatrist on staff, an agency is going to significantly lose money and able to support that individual. And that is why we don't have medical professionals wanting to go into psychiatry, because they will not be able to make the money they should as a medical doctor. So.
Okay, thank you,
Karen, can I jump in here for a second? Because one of the things I noticed in some of the comments that Karen was looking at that have come in through the chat, I think perspective is often good. In the county, we have just short of 300 employees working for the county. I think just short of 100 are in Health and Human Services. So 1/3 of the county's resources go to Health and Human Services and the related programs and functions. So I think that's important, because sometimes I think in maybe different communities that ratio is different. Maybe there's more money that goes to law enforcement or some of those kind of things. But if you look at the county's budget, there's a very significant piece of it is under Karen and on her shoulders. So
Yes, and I also do want to make a comment too that we are a state supervising county administered program. So what that means is that the state gives us our infrastructure. It says this is what you have to do within your county system, and you need to operationalize it at your county level. And then we have to assure that we're meeting our performance measures that the state hands down to us within that infrastructure. But we can do some I guess, molding into to assure that we have the services available that are unique to Winona County. So we just can't make changes at the drop of a hat, that we have to work with individuals at the Department of Human Services to make these changes. And so we spend a lot of time working on legislative issues. Probably I would say 15 to 20 hours a week. That is what I do, is working on legislative issues, especially this time of year, gearing up for the legislative session.
Okay, and we've got about 4 minutes left. I've got a couple more questions here. This would be to, I think, Steve or Jeff or Ron. What changes have been made? I'm thinking it's focused on the jail. Since COVID-19 started, have the current facilities been upgraded to accommodate those changes? What are the costs associated with the changes? And then related to that, it seems the pandemic has shown us that Winona does not need a larger jail. It's this questioner's understanding that upwards of 75% of the inmates were released and the public has remained safe. How has this information impacted the decisions of the jail project? So when do you guys want to?
I'll start it for sure with the jail aspect of it. So this is Steve. So the pandemic wise, what have we done? There's nothing brick and mortar that we did or actually could do with this. First of all, during the pandemic, we all were told that this was going to be a matter of like a couple of weeks to a month. And then as I got into it, we were told basically that it would be like a couple of months, and then the couple of months now turned in from when we first enacted the governance of what we've been doing from the county as far as turning this into like a COVID facility. Like I said, for the congregate facility, attitude was March to current. What we did is we focused on decontamination. So we made sure that staff had all the personal protective equipment, inmates were able to, or detainees were able to have masks and be able to wash their hands and have decontamination and hand sanitizers and stuff. Obviously, we don't leave those sanitizers back into the housing units. We'll bring them around to them if they want whatever squirt, almost like you're walking in Winona Health or Walmart. You're Hy-Vee, you can get those little hand sanitizers and take care of yourself. Leaving them back there would be bad. But nothing was done brick and mortar wise. As far as the amount of inmate population that went down, like I said, our average daily population was 50 inside of the Winona County Jail, and strictly just during the COVID time, it was 26. So not quite 50% of the inmate population isn't in here. The courts have really slowed down. The courts aren't really doing what they did, and they're not sentencing either. They're delaying this stuff out, which has quite a backlog, as Karen and everybody knows, for the criminal justice system on that side. As far as law enforcement goes, I'll leave that up to the chief deputy, but the jail will take anybody that is obviously a serious risk to themselves or the public while they're out there, going back over the whole purpose of why we are inside of the jail. And I'd like to emphasize, I just must not forget to emphasize this. We have been working over the last really 15 years from the Annex and then going back to the 13 years of Criminal Justice Coordinating Council, community collaboration, diversions, and not having people just be in here. So we have been really diligent on making sure that people get out. And if people understand the statistics of the number of bookings that you come in, the length of the time that they stay in here equals your average daily population. Well, our length of stay went from 18, 16, and now down to 10. Pretty significant and unheard of in a lot of jails. And I don't think a lot of them even addressed it until COVID, and we've been addressing it for at least 13 years.
I would just like to say that to keep,
Real quickly, Ron, because we're
Yeah.
running out of time here, but
I just want to say that we do everything to keep everyone safe. The staff, the arrestees, anyone brought in here, or anybody that comes in to visit. As soon as COVID got going, we locked the front door and did a business differently. We put in place a policy that if someone got arrested, they had to wear a mask in the squad car coming to jail. If they got here and they didn't have their mask on, staff, if they couldn't wear a mask, we'd give them a shield, face shield. But we clean the place before they get here. We process them in, clean it right afterwards. We're doing everything we can to keep that arrestee safe. And then they're quarantined if we have to keep them. I mean, if we release them, that's one thing, but if we're going to keep them here, we're going to quarantine them. And after the quarantine, then they'll go to Houston County. We don't send them down to Houston County right away.
okay, I think with that, because we're up to our 20 minutes of question time, and I've been told by our tech person that we're gonna probably lose the Zoom on this. So first of all, I want to thank all the panelists. I want to thank the audience for your questions. We have all your questions, and if we didn't answer them, we will make sure that you get answers to those. So they will, as I think we indicated on the To All site, that we'll publish those in the county's website. As to some people have questioned the framework of this forum. It was designed as an educational forum, an informational forum, and I know that the commissioners are listening in on this forum and will take under advisement, if you want to call it, the question of whether there should be an additional forum or not. COVID does make a difference where we can't have a in-person forum, which we did 2 years ago, and had opportunities for people to ask questions in that. So we did have to make some changes here due to the COVID and wanting to make sure people are safe. So with that, please stay tuned. The board will be taking up the issue of the jail and also discussing other future potential community forums or some kind of, but it's up to the board to make a decision on that. That's a policy issue. This was an educational forum, and we thank you for all the time that you've taken to listen and submit your questions. So at this time, I'm going to once again thank the panelists, thank all the attendees, and wish you all a good evening. And again, the next meeting of the board on the jail matter is December 22nd. That's a morning meeting, and that is at 9 a.m. So thank you all.